Well, it's been an unusual year, very different from any of the other years. I think the whole service went through a stage of being shocked and a lot of adjustment that was needed. And obviously, for a period of time, we closed down. So I think for the staff team in particular, there was a lot of adjustment because they weren't supporting people that they were used to or they're here to do originally. So yeah, it's been a year of kind of relearning the rules, really, I think.
Well, I come here because I enjoy a lot of things here, and I meet a lot of people, new faces and that. I'm upgoing, I like doing everything, arts and crafts.
Some kind of just sailed through it and quite enjoyed having a break and being, having a rest and spending time with a family or with other carers and stuff. And then there was people that struggled, and especially towards the end of the lockdown, we had a few individuals who really struggled, and their tolerance to sort of being isolated in that way was really showing, I think, in behaviours when they returned and stuff like that.
In Mackie stress now, we've a couple of weeks, years before it shut down, all bored at home. Now we come back, everything's okay.
But now we have got people back, so that in itself had challenges, trying to make everything as safe as possible for people to return. And again, it was another adjustment for the staff team because they have to ensure that people are here and safe, but also for the people returning. So, they went from being shielded and in a lot of cases, self-isolating to coming back to the service. It looked very, very different with all the zones and the bubbles. So I think it's about establishing that sense of normality, routine, that we're here to support them, to rebuild sort of relationships with the staff team. I think because of how we've had to divide up the groups, you do have people that wouldn't have necessarily worked with people and stuff. So it's re-establishing those bits and pieces. I think it was like trying to reduce people's anxieties was very much in the early days, using the PPE for themselves and seeing staff in PPE.